Hello, class. This is for CRJS371, Pathology of Death Investigation. I am Professor Raven Coleman, the Forensics Coordinator for the Department of Criminal Justice in North Carolina A&T. And I am going to give you a very kind of short highlight. This is kind of my TED Talk. For a video lecture, just kind of touching base on a few things that I want you to take away from some of the chapters. Today we're going to discuss chapter 3, which again, these video lectures are to be used as a tool to your already reading assignments, PowerPoint slides that you have for the accompanying chapters, okay? With chapter 3, we discuss death certification, and it is a very, death certification is a very important document for families to be able to resolve estates, as well as a means to monitor public health trends and prevention of death. It is important to distinguish causes of death from mechanisms of death, as well as have a very good understanding of key investigative issues used to distinguish the manner of death. Okay. Death investigators usually serve as a final safeguard of any type of questionable causes of death to prevent unreported cases to the death investigation system for that state, and also serve as a resource for vital records or the vital statistics department in your county departments, and also families. It's important that as a death investigator, you have a very good working knowledge of causes of death that may appear accidental or suicidal or homicidal. Some of the objectives for chapter 4 that I want you to definitely make sure that you hone in on are distinguishing cause of death from manner of death. As well as identifying causes of death that might need further investigation as to the reasons why it would need to be investigated in the first place. As well as you're going to answer any questions that would need to be asked to determine if jurisdiction would even need to be managed by your office. Understand the purpose of a death certificate and its role in vital statistics and final affairs of the decedent. Understand that the impact state laws regarding age of viability and live birth on proper death certification. Chapter 3 also kind of ends up with talking about therapeutic misadventures and questions that need to be answered to differentiate whether or not an accidental manner versus a known complication for a natural disease has occurred. Definitely some of the question I want you to take away from chapter 3 is being able to identify some examples of when a death certificate is important and what would happen if a death certificate was incorrect or became unavailable. What are some ways that cause and manner of death can be differentiated, and identify some examples of those. What are some complications that you as an investigator can encounter when dealing with fetal deaths, as well as what do you need to know to avoid complications? The death certification, especially in North Carolina, has to be is required when we're dealing with transport, especially if you have it's required for burial. A body cannot be cremated without it. It also serves as a transit permit if a body has to be taken over state line as well. So that is chapter 3. Have a good day.